Hello, I'm Phil Fogg, CEO of Marquis Consonus Healthcare and Age Right Care Management Solutions. Now that we're several weeks into this COVID-19 pandemic, I wanted to take a moment to thank every staff member and leader for all you've done as we've navigated through this crisis together. You've remained committed to our residents and patients during this time of unprecedented uncertainty. Who would have ever thought that we would be in the place where we find ourselves today? You are all enduring perils and difficulties with grit, passion, and even sometimes humor. In times like these, words like rock star, champion, or even hero fail to do justice to the difference you are each making. Especially in our home care and facility settings, all of you have become the social fiber and virtually the sole human connecting point for our residents and patients. Beyond the care you deliver, you're their son, daughter, friend, or advocate, and your empathy and love is vital to their emotional and mental well-being. Though further from the bedside, those of you working in pharmacy are more critical now than ever, ensuring that whatever happens, even as other healthcare systems are strained to the breaking point, our residents and patients always get the right medications on time and accurately. In a host of other vitally important supporting roles, the value of what you do simply can't be overestimated. While we're keeping intense focus on preventing and containing the coronavirus, we're also doing everything we can to help all those we serve in our senior care communities not feel so isolated and alone. Through our Send Seniors Love and Virtually Vital initiatives on Facebook, you can share your love and support with them by sending a card or letter, or by posting photos and video. I would strongly urge all of you to participate in those exciting programs, as it brings incredible joy to our residents, patients, and facility staff. Now I'd like to shift gears to the future and what the next few weeks and months might look like. Fear and anxiety are perfectly normal at a time like this, especially since the COVID-19 virus has been particularly hard on the elderly population that we serve. I am sure that you, like us, are wondering how long we'll be in this period of restricted visitation, social distancing, or sheltering in place. I've invited Dr. Catherine Kolonich, our Chief Medical Officer, to share some thoughts about that.
Thanks, Phil. You're absolutely right that no one knows for sure what the lifespan of this virus will be in America, but there are definitely some reasons for optimism and hope. Countries such as Singapore, Hong Kong, and South Korea that have implemented aggressive tactics like widespread testing, social distancing, shelter in place, and restricted visitation have flattened their curve and probably avoided the worst of the pandemic's effects. Here in America, we've had the opportunity to learn from these other countries, both what to do and what not to do, and I think that's been enormously helpful. Most epidemiologists and other experts agree that it generally has taken about 8 weeks of social distancing and other measures to slow the virus, and these steps are being taken in most states. Generally speaking, as we look to the future, we've been dealing with COVID-19 in significant numbers for about a month now, and are about in the second week of aggressive social distancing tactics. That means we are probably going to see the peak of the outbreak in the next 2 to 4 weeks. In other words, although as a country we've been doing many of the right things, unfortunately it will get worse before it gets better. Despite that somewhat gloomy forecast, there are reasons for optimism. Some viruses, like SARS and MERS, declined in the summer due to high temperatures and people not being together as much. We don't know for certain that will happen here, but we're hopeful about it. Also, much of the higher mortality rate in China and Italy appears to have been due to the medical systems being overwhelmed and a lack of access to proper equipment. Though the United States is also experiencing shortages in some geographic areas and has been a bit behind in its preparations, the healthcare system overall is reacting in significant ways. The longer we put off the peak of the outbreak in other places outside of hotspots like New York and Washington State, the more likely our hospitals and other facilities will have time to be ready. Another bright spot is that access to testing, while initially inadequate, will continue to grow dramatically in the next 2 or 3 weeks. I'm also relieved to see that Americans seem to be taking the virus more seriously now, and despite the crowds of spring break partiers we've seen in some locations, I'm cautiously optimistic that compliance with social distancing restrictions will continue improving. Of course, we're all holding out hope for the continued development of antiviral medications that can treat and beat COVID-19. And as you've seen in the news, there are some promising clinical trials in process. Around the world, the race is also on to develop a vaccine, and though that's probably a year or more away, it will make the future waves of this disease far more manageable. Bottom line, we're going to get through this. The next 2 to 4 weeks will perhaps be the most difficult, but with all of us working together, being patient, and abiding by social distancing restrictions, this pandemic will fade. Not easily, not quickly, but things are absolutely going to get better.
Thanks, Dr. Kolonich. I should also add that another huge issue has been shortages of personal protective equipment, or PPE, like masks and gowns. It's been all over the news these days, and people are understandably concerned, as it is impacting providers across the healthcare continuum. By controlling their use, Marquis and Consonus have had all necessary supplies, and we've been working 24/7 on building an emergency supply safety net to be able to meet the demands of a worst-case scenario. This has been no easy task, and we've had to go outside of our normal U.S. supply distributors. But one of the benefits of being an industry leader is having deep connections and access to non-traditional channels. So we're doing everything possible to ensure our staff, residents, and patients always have the protection they need. As our emergency PPE supply is built, you will see us changing and expanding use of certain products preventatively, so please stay tuned for updates. Also, as the pandemic affects our various Marquis and Consonus work environments, I think it's important for all of you to know the leaders who are driving our infection prevention and control policies. Our team is comprised of April Diaz, Vice President of Clinical Services for Marquis, Vicki Nordby, our Marquis Infection Prevention Program Manager, and Dr. Catherine Kolonich, Chief Medical Officer for Marquis and Age Right. Thank you to all of them. Every day, they're monitoring evolving guidance from the CDC and other established sources to formulate clinical guidance for all of our settings. These individuals are nationally recognized experts, and we are fortunate to have their leadership and expertise driving our decision-making. In closing, let me take this moment to thank you once again for your dedication and commitment to not only Marquis, Consonus, and Age Right, but to the residents and patients we serve. Somehow, beyond the fear and uncertainty we all feel, you're reaching deep inside for extra levels of courage, patience, focus, and excellence. And that is a source of inspiration and hope to all of us. Thank you.